नमस्कार, मैं हूं प्राध्यापक डॉक्टर राजेंद्र देशपांडे and today we are going to discuss about an important topic regarding the Panchakarma. Because as you know that Panchakarma is a best treatment to avoid the recurrence of the disease, and also if at all there is a recurrence, the intensity of the disease will definitely reduce after doing the Panchakarma or the Shodhana treatment or the detoxification treatment of Ayurveda. Today, we are going to discuss about the back pain problem and how we can apply the different Panchakarma modalities in the treating the back pain. Myself is Professor Dr. Rajendra Deshpande from Pune. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can contact me on WhatsApp 9226810630. तो चालू करते हैं बैक पेन के बारे में. First, we will discuss about the pathogenesis and some symptoms. स्पेशली पैथोजेनेसिस, जिसको आयुर्वेद में विकृति कहते हैं, संप्राप्ति कहते हैं. दिस पैथोजेनेसिस पैथोलॉजी इन्वॉल्व्स बेसिकली द वर्टिब्रल कॉलम, देयर लिगामेंट्स and the various muscles attached to that vertebral column. That means the back muscles. The aggravated doshas, according to Ayurveda, there is always a problem with the bioenergy or the dosha. So Shleshak Kapha is responsible for the lubrication in between the two bony joints. That Shleshak Kapha, by chance, it is get reduced, and that is one of the reasons for the backache. Then there is a problem with your digestion, metabolic process, Samana Vayu. Then Apana Vayu, if your stools are not proper, if your urination is not proper, according to Ayurveda, that also can affect the musculoskeletal system. Because Ayurveda says, according to Ayurvedic some principle, it is said that Ya eva asthidhara kala, sa eva purishadhara kala. That means Ayurveda has related these, what you can say, the bone structures, bone pathology, and your normal metabolic process in the body, especially about the stools. If the stools are not normal, if there is a constipation, your backache problem will definitely increase. That's why there is apanvayu involvement, and sometimes circulatory problems are there. Blood circulation may not be proper at that particular place. So that is a Vyana Vayu problem. But of course, when we talk about some nerve compression, then there is a concern with the Pranavayu as well. Because Pranavayu is nothing but the nervous system engaged at the level of the brain and the spinal cord. Okay, so back pain is a common complaint, especially in the middle-aged male and the females. Okay, so back pain causes, the causes are different for the both genders. The common causes are like that: lack of proper exercises, sedentary style of lifestyle, that means your occupation is always a sitting job. Then there may be obesity. Obesity always gives the pressure on the different bony joints, especially the knee joint. But even obesity can cause the pressure on the back muscles as well, especially when you are bending, standing, and walking. Then improper posture is also very common cause nowadays, because the people are not sitting or standing or walking in a, what you can say, the elevated type of the their body posture. So bending body posture always gives some contraction phenomena in the muscles. Inherited weakness, that means the some family tendency of the bones and muscles, are some of the common causes of the back pain. Now, in the elderly person, there may be some degenerative problems, destruction, such like, especially all these are the early degeneration in the bones, muscles, ligaments, etc. Osteomalacia, that is the softness of the bones. Osteoporosis, that matrix has been porous, is not a compact and solid in consistency. Vitamin D deficiency, vitamin B12 deficiency. So nowadays, whenever the patient goes for the leg pain or the back pain or the joint pain, doctor always advised to go to the laboratory, pathological laboratory, and do the blood vitamin D test and vitamin B12. These are the costly tests, around about 1,500 rupees. So better way, you are always, what you can say, the prevent this type of the deficiencies if you get a proper exercises and also expose yourself to the proper morning sunlight. Okay, calcium deficiency is also one of the cause. Especially the people think that the children should only drink the milk, but you get the maximum calcium from the milk as well as some dates. So eating dates regularly and taking a cup of milk with Shatavari Kalpa or the Shatavari powder, that use the basic natural source of calcium. Then in the males, there may be prostate problem, and because of the prostate also, especially cancer, that can give the vertebral column problem. Then causes in the females, there are the multiple pregnancies also makes the calcium deficiency and weakness in the muscles and joints. Chronic cervicitis, which is also called as a cervical erosion, is one of the cause of back pain. Uterine fibroids, tubo-ovarian mass, that means fallopian tubes and ovary, there may be some tumors. Other uterine pathology can cause the low back pain in the females. Now, for both the male and female, common causes, once again, obstruction in the vertebrae, compression like this. So nerve pressure will be there, especially the diseases of intervertebral disc, which is called as a prolapse intervertebral disc or the slip disc problem. Then tumors may be there, soft tissue involvement, tubercular spine, that means which is also called as a Pott's disease or the cold abscess. Because the common people think that TB is only affecting the chest or the lungs, but it is not true. TB can affect to any part of your body, especially the vertebral column, and also it can affect to abdomen also, ileocecal joint. Diseases of the retroperitoneal organs like kidney, if the kidney problem, then there may be back pain. Intraperitoneal organs may cause the back pain. So for ruling out, that means a criteria of exclusion, that means you have to rule out all these problems by doing some ultrasonography of the abdomen. Then you may do the X-ray, cervical, if there is a neck pain, cervical region X-ray, or the lumbosacral, if there is low back pain. So these X-rays are taken in the AP and lateral view, and in severe cases, like for example, you cannot find any reason with the sonography or the X-ray, and still the back pain is continued with the even taking the treatment. Then lastly, you have to go for MRI. MRI can detect this type of the Pott's disease or the tuberculosis of the spine. Then some simple causes, but they are not taken care of. That is the driving on the rough road, long use of the old vehicles having no shockproof mechanism. Then heavy weight lifting. Sometimes you do the excessive aggressively this type of the gym, and sometimes that can make a natural trauma to your lemniscus or the meninges. The ligaments. Now, back pain treatment, due to the varieties of the different causes, the treatment of back pain is not generalized. That means you cannot do all the things for all the type of the back pain, because you have to find out the exact cause. And Ayurveda says, Samkshepataha Kriya Yogo Nidana Parivarjanam. That means the first management should be try to avoid the cause or try to remove the causative factors. Then possible elimination of the basic cause behind the back pain. Then you can do the Panchakarma therapy with Kundalini massage and oral herbal supplements. Herbal treatment is helpful. Back pain, first treatment is of course the oil massage, because Ayurveda says all the pain problems are because of the Vata disturbances. So Vata dosha can be controlled by Snehan and Svedan, oil massage, lubrication, and also fomentation. Everyday massage, which can be executed by oneself, or that means self-massage is also possible at some part, not on the back, but some part it is possible, and by a professional, your relative, your friend also can massage you, or a professional masseur should be done on the regular basis. Ayurveda says the Abhyanga or the oil massage should not be the activity of only Diwali or Deepavali in India, but it should be the activity of the daily type of the routine. Dinacharya, Ayurveda says Abhyangaha acharet nityam. Oil massage is helpful for everybody as an anti-aging management. Okay. In just the same way, like machine, any machine, scooter, cars, they need the greasing. That means oiling is always needed. That's why we do the servicing of our vehicles. Similarly, our body, especially back, should be oiled and revitalized. You should give the energy to your back muscles and the bones. Narayan oil or Narayan tail, prepared from the asparagus racemosus, that is shatavari, or the oil of Sida cordifolia, that is the bala tail. Both these oils, either of, can be used for the oil massage. Now, one must keep in mind that such type of the oil massage is not indicated, or you can say the contraindicated in surgical types of back pain. Whenever there is a surgical type of neurological involvement and the PID, prolapse intervertebral disc, and the nerve is totally compressed, and you may need the immediate or the emergency type of the surgery, then you should not rub that particular part. So oil massage is contraindicated in neurological involvement of the back pain. Kundalini massage is a type of massage in which marma points are activated by soft pressure massage technique. Then, of course, Ayurveda Academy has this type of the specialist doctors who can do this type of Kundalini massage or the different types of Panchakarma therapy. So whenever you need any help from the Pune, Maharashtra State, India, you can approach to Ayurveda Academy by WhatsApp. Then Chavetti massage, that also we do in Ayurveda Academy by specialist doctors. Chavetti means the feet. This is typical Keralian type of the massage, but this is very strong massage. Whenever you do the massage with the feet, the masseur's feet should be very soft. Of course, they should be firm, but softness should be there. There should not be palmar, what you can say, the features. Crack should not be there. If the palm or the sole is rough, then that masseur cannot do the good massage to the patient. This style of massage is done by using the feet. The therapist is giving the pressure by the feet on the back and legs. Very beneficial for curing the muscle-related back pain. It is not that much useful for the ligamental injury. This is not at all useful for the neurological problems. This is not also useful for osteomalacia or osteoporosis, but this is useful when there is a stiffness of the muscle. So that's why we should diagnose properly what is the exact cause of back pain. It is done by the expert masseur only. Nobody can, simple therapist cannot do that. Oil medicated with cedar, that is Devdara, Vitex Negundo, that is Nirgundi. These are oils that are used for this Chavetti. Then there is a next treatment is Pizhichil, which is useful for back pain. In this type of massage, the masseur takes warm oil in a pan, soaks in a piece of cloth, and then squeezes over the affected part of the back and massage gently by the other hand. This treatment tones the back muscles and relieves the stiffness over the back. My dear friends, if you are interested to learn Panchakarma, Professor Deshpande, that is myself, has prepared the mobile app where I have a special program of Panchakarma. So you can buy that particular program to learn Panchakarma techniques. Back pain, next treatment is a Basti. Basti is also very specific treatment for Vata bioenergy disturbances. Medicated enema, the similar name. This is very effective in most of the types of back pain. A series of medicated enema are given. To start with simple, what you can say, the Anuvasana Basti, 50 ml of the sesame oil enema is given. It is Anuvasana Basti or Matra Basti before going to bed. Then next day, 450 cc of 10 roots of decoction, that is Dashamula Kwath. Dashamula 10 roots, Dashamula Kwath. Bilva Agnimanta Shonak Patla 10-2. Shaliparni, Prusniparni, Bruhati, Kantakari, Gokshu. These are the 10 plants. The roots are used for the decoction and 20 cc of sesame oil is used. Such type of that means alternate Anuvasan and Niruha. Anuvasan and Niruha. Niruha is also called as Asthapan Basti. So this particular combination, Anuvasan Asthapan, can be given for 3 days, can be given for 7 days, or can be given for 11 pairs. 3 pairs, 7 pairs, or 11 pairs of oil. That's Niruha and Anuvasan. And this is called as a 3 days is called as a Karma Basti procedure. 7-day pair is called as a yoga type of the management, yoga Basti. This yoga is not concerned with your Yamaniyam, Pranayam, Pratyahar, Asan. It is not that yoga. Yoga is something, another name given for this Basti program of 7 days. Basti program of 7 days is called as a yoga Basti. Yoga Basti, Karma Basti, and Kala Basti. Kala Basti means 11 pairs of the Anuvasana and Asthapan are given as per necessary. Next treatment is a Dhara for the back pain. As the name suggests, a stream of medicated oil is poured over the back, and it is called as a Kati oil Dhara. Kati means lumbar region, lumbosacral. Kiji. Kiji means a potis. This is also South India treatment. Different potises with different herbs are prepared with which vary according to the disorders of the back, whether it is a nervous, neurological more origin, muscular origin, or the bony origin. Accordingly, the plants are selected and given this potis treatment. Here you can see the Dhara oil is poured on the cervical of the back region. Navarkizi, that means boiled rice potises are prepared. It is cooked in the Bala decoction. Bala is a herb, name of the herb. Bala means strength. That is the name of the herb. So this is Navarkaji. This is a special type of rice. Next treatment is Kati Basti. In this warm medicated oil is retained 20 to 30 minutes over the back with the help of application of circular dough prepared with wheat flour and water. Next treatment is whole body fermentation, that is Svedana, Snehana and Svedana, Vata treatment. In closed box, that is called as Svedana Peti, with the help of medicated steam of Vitex Negundo, that is Nirgundi, Cedar, that is Deodar, Eucalyptus, the fumes are coming and the fermentation is done. This is, of course, Svedana is always given after the oil massage. This is Basti. Here you can see the dough and the oil is, warm oil is always poured. Now, internal treatment for the back pain is Punarnava Guggulu, you can give, or Triphala Guggulu. When degeneration is more, then you can give the Punarnava Guggulu. And when there is a congestion is more or the obesity is there, then Triphala Guggulu is given. These are the tablets, 2 tablets in the morning, in the afternoon, and in the evening. With the Anupana should be, the carrier should be Rasnadi Kvath. Kvath is a decoction. Rasnadi Kvath, 4 teaspoons with equal amount of water with this tablet is given as an internal medicine to control the back pain. If anybody of you suffering from ITP, idiopathic thrombocytopenic purpura, anemia, diabetes, hypertension, for paid online consultation, you can definitely WhatsApp. These are all educational videos, so better way self-medication should be avoided and कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना जरूरत है. Please like this video, share this video, and don't forget to subscribe my YouTube channel and press the bell button icon to get the notification whenever the next video. Of course, the more times every day there is one video. So I wish you all the best, and I thank you for your nice cooperation. See you in the next video. All the best.